first part, we have seen a few cases of fever, urticaria, and other very, very simple acute things. One case was of that was very interesting. That was of Bell's palsy. But here now, we are going to see something that is very, 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 very interesting. And that interesting thing is we are going to challenge ourselves, challenge our limits, and go ahead and do certain kind of study. If all of us could give considerable amount of result in so-called surgical cases, some emergencies which are considered to be acute emergencies or which are falsely implicated as surgical emergencies. So what are the emergencies? As one of the best and most famous American astronaut has said, emergencies require a very clear mind. You should be very clear. When you get an emergency, an attack of asthma, or some mental emergency, or some psychological, psychiatric emergency, but treating those things depends upon your legal domain, legal framework. So acute emergency prescribing requires, as we have discussed, sound knowledge of medicine, materia medica, and your observation skills. So how you must observe? What I usually have in my practice, in my office, there is a CCTV installed like everybody has in the waiting room. So waiting room is one part where the patient sits unobserved. So you get a lot of information if you observe the person when he thinks that nobody is observing him. So he will, do whatever he wants, like any so-called shabby things like putting his fingers into nose, rubbing his eyes, ears, biting his nails. So these things are the symptom. These are the symptoms upon which our acute prescription or chronic prescription should be based. So this is a case of paraphimosis. The patient called me from Russia. So paraphimosis is a condition where the retraction of the foreskin is not possible because of fungal, because of natural tightness, because of some kind of infection. It is the most common emergency in infants and children. So he was a small boy in chilling temperature or chilling atmosphere of Russia. He had the symptom of paraphimosis. He was unable to pee. So the information that I could gather was swelling of the part, child crying while passing urine, itching of the part. You know why? Because phimosis is such a painful condition. And so warm urine, swelling, and the most striking feature was itching of the part. So I have taken the symptoms like phimosis, confirmed. Paraphimosis, burning pain. Why I have taken burning pain? Because the mother told me that the part is red or the part has got, the heat. It is emitting heat. Itching of the penis, itching of the gland. So burning is a controversial symptom. You may or may not take it. So digitalis was given 30 potency 4 times a day.